Hello, good morning. I wanted to introduce a tutorial on some ExoPLAN basics, really just bringing in, starting a posterior case, bringing in the STL files for the upper and lower jaws, and introducing some of the new features in ExoPLAN 3 or Galway, and then talking a little bit about some of the nuances that I've discovered in transitioning from not just a surgical plan, but then to a restorative plan. So what I mean by that is we're going to be doing guided surgery on a few implants, but we also want to perhaps create some healing abutments to already start to sculpt the tissue, or maybe we want to design provisionals for immediate loading or for loading at stage 2, and how to go about setting that up and doing that in ExoPLAN/ExoCAD. So for those of you that are knowledgeable of ExoCAD, I think many of us would start a diagnostic case instead of using anatomic crown here, we would probably start it with either a mockup right there or anatomic Pontic. Many of us would choose that. The problem with starting your case for an ExoPLAN plan or case is that once you start the case as a Pontic, and then you want to go and continue that case and press design after you are done with your implant planning, that anatomic Pontic information is sort of embedded in the case file, and you have to start completely fresh, I guess, and I don't really know how to explain it, but basically, like, you want to set it up as an anatomic crown for starters. What happens is, in the design mode, you get to the very end and you're not able to merge your design parts together. So you're going to design the connection to the tie base or to the implant. You're going to design the screw channel, and at the very end it's not going to give the option to like make a part, which is very frustrating, and it's all because it was set up as an anatomic Pontic versus an anatomic crown. So with that anticipation, this is how I'm going to design this case, so we can see implants at 4 and 5, a Pontic of 3, we're going to cantilever to 3, and then an implant at 14. So with that, we'll get started. We'll launch this case. All right. So now that's all set up. Models in 2-stone models in whatever articulator you're using. Press save. You're going to create the folder, and then we can click for starters on implant planning. So we're going to load this up. Again, this is focusing on the new version of ExoPLAN 3.0. All right, so lower jaw. CT data is next. Oftentimes it will find the parent folder, but a lot of times your CT data is in a different volume of folder. You just have to click on your parent folder. This folder was named Tutorial ExoPLAN. So I'm just going to click down. I'm going to find the volume that the CT is in, and I'm going to press OK. This is all blurred out because of course it has some patient information on it. And this is the next step. So we're going to set our focal trough. This is called the focal trough. You want these control points just in the middle. You can add a control point just by clicking on the line. And anyone who's done any digital implant planning, this is very similar to a lot of different programs. All right, so in the middle of the bone, We'll press next. CT to mesh alignment. We can adjust the threshold if we want, although I don't believe it's really necessary at this point. Okay, this is, we're going to bring in our, in this case, upper jaw, because the implants are all on the maxilla. You want to do 3 points, and you want them sort of broadly spaced. These dots do not have to be exact; they just have to be in the general location of matching. Sometimes it's nice to do buccal and lingual cusps to get a little bit more triangularization. This oftentimes pops up. I may have talked about this in the past. This is it's identifying other STLs that you have aligned, and my understanding of this is essentially you don't want to click anything here. You just want to press accept. Basically, what you're doing in this decision is you're bringing the CT to your jaw scans, and since your jaw scans are correctly aligned from your intraoral scan, then you have the proper occlusion, that sort of thing. You don't want to break that, so don't click anything here. Just press accept. Great, so this is initial alignment, and then we're going to press next for best fit. And then at that point, after best fit analysis runs, then we'll check the alignment. Okay, perfect. So for checking the alignment, I want to use this screen here that scrolls through the focal trough from right to left. So I'm going to maximize that by clicking this icon here, the little box, big square, little square. And if I want to get back to my 3D sort of viewer right here, I'll just click on that again. All right, so I'm going to go scroll through really the entire scan from posterior to anterior. A little bit of misalignment there. That's a decent amount of misalignment. Let's see if it improves for the rest of the scan. Everything looks good there. That looks good there. That looks good there. And that looks really good there. So that may just be a function of scatter because the tooth in the back, that's nicely aligned. So I'm going to accept this. But if the whole side of the jaw was like this is kind of my threshold for starting to be concerned about the model not being aligned to the CT data. Your guide will always fit the model, but of course you want to align to your X-ray for precise planning, right? So I'm going to click continue with acceptable alignment. So ExoPLAN 3 has a sinus segmentation, and if you're working on the mandible, it also has a IAN or alveolar nerve, segmentation, and you have to do the IA nerve. You don't have to do the sinus segmentation, and honestly, I don't see the point because they're pretty easy to identify. So I'm going to skip this pretty much always. All right, so the very first step it's going to ask us to do is put in some Pontic teeth. And the really nice thing about using ExoPLAN as a program is you have all the initial wax-up features that you have in ExoCAD. Now, the exception of this is this is a very useful tool for posterior teeth, but if you need to do an anterior wax-up, like an anterior wax-up where you're changing a lot of different aspects of the anterior teeth, aesthetic-wise, maybe function, position-wise, you really need to do that first. This is not the full kind of version of the placing of model teeth. So I think if you really need to do a more comprehensive wax up initially, the first step is to do that in ExoCAD and then bring that in as a pre-op into ExoPLAN. And then align your implants, you know, from a crown down type of philosophy or restoratively driven philosophy, align that from your pre-op diagnostic model or diagnostic wax up. So it's going to tell us what to do here. So mesial contact of 5, that's going to be here. And then bring it down to the distal contact of 3. And we're going to press next. This is our tooth library. So I don't change this for posteriors, but for anteriors, you definitely have choices of tooth libraries. Okay, so we'll press next, and then we'll do the next tooth. Try that again. Okay, next tooth. So mesial contact of 14. And if you mess this up and your tooth is spun around, that's okay. You could either redraw your points or just spin it around in the next step. So we're going to click next. And now we'll get into more tooth placement tools. So this will be your standard simple and chain mode. You're going to remove the lower jaw for a second. The lower jaw in this case is the antagonist, so that shortcut for that is A. And there's, I think the fastest way to align a wax up is in 2 views, the occlusal view and then switching over to a straight side view or perpendicular view. The movement of these teeth is always perpendicular to the screen. So I don't like moving them, for example, in this angle, because you're moving them not just down, but you're also moving them to the side. So I always will move basically from these 2 views. So I'm going to align it here. You can resize by holding shift and then clicking your left mouse click and making these teeth a little bit bigger or smaller. You'll notice the arrow comes from the center of the tooth. See that green arrow? So if you're close to the center of the tooth, you don't have a lot of room to resize your tooth. If you're far away, you have a lot more control over that. Good. The other shortcut, I'll just talk through some shortcut buttons as I go, even though it's repetitive. But the center wheel button, the wheel does your zoom in and out, but if you click on that down, that will reset your view and also reset your axis of spinning. And I use this a lot instead of having to hold both mouse buttons and move the model to my focus point and then clicking the center button to reset my axis of rotation. A lot of times if I can see, let's say I want to get to this tooth over here, I'll just click on the center button and reset my view. It's a little bit faster to move around an arch. So you'll see me doing that a lot. Okay, so I'm going to just change the orientation of the teeth. You can hold control, and control can, what control is doing here is controlling the angle, I guess, of the tooth. So if this tooth was spun around, I could completely move it back and correct its alignment. Make it a little bigger. That's too big. So control and shift, you basically keep your fingers on them during the planning process, when you're doing tooth movement. All right. So that's starting to look good. I would like to get a better contact there. I think more than likely this tooth is going to need some help contour-wise, maybe recommending composite restoration there prior to delivering a crown, because that's a pretty poor contour to deliver a crown to. Good way to get recurrent decay. All right, the next view is to check this, check check the antagonist. We can see that there's some occlusal problems there. Now for planing purposes, if you're just concerned about centering the teeth over the ridge, you don't really have to worry about your occlusion at this point. You just want to make sure your buccal corridors are properly aligned. I use this view to do that. You can see that that's starting to look aligned. I also use this view to double check the alignment of my wax ups. Okay, perfect. Let's go to this side now. Rotate this tooth a little bit. Make it smaller. Okay, so see how I'm trying to develop reasonable, realistic contact points. That might even be a little too much of a contact. Good embrasure form here, good embrasure form here. Tooth is a little bit crooked. Again, my two main views are straight side view and straight occlusal view for tooth positioning. Make that a little bit bigger now that I've changed that position. And that's looking quite good for planing. It might be a little bit, maybe could come a little bit to the buccal. All right, so I like that. Now, we're going to click next. And actually, before we click next, let's show off another feature that is new to ExoCAD here. Let's go to expert mode right here. And to turn off the CT data, the hotkey for that is D. And if I just right click on the back screen, I want to virtually extract a tooth. So this is a pretty nice feature to just remove a tooth. A lot of other programs have this, so I'm glad that ExoPLAN has this as well. So we have a couple choices here. We could make this a virtual pre-op. So when you select a tooth, it's going to remove the tooth and then create a pre-op file, and usually that's a blue colored tooth. You could also just say I just want to remove it and I don't want to do anything, but I'll show you what the virtual pre-op is. All right, so we'll press OK. We're going to now, oh, sorry, I messed up on that. Let's do that again. Before pressing OK, we want to actually select the tooth. So we're going to click this tooth. Now this tooth is being removed due to a periapical lesion. And then right here, this is sort of the axis of removal. So you control this little green button to just come straight out. That's going to affect how the Pontic bed is created. We can change how much of a Pontic site we want, if we wanted to do that. And we're going to tell it that this is tooth number 5. And then if you wanted to extract another, you would click extract another. It would perform the extraction of this tooth, and then you could extract your other teeth. But since this is the only one we're extracting, I'm just going to press OK. And you can see here, there is our extraction site. So the reason for doing that, especially on this case, is when we make the surgical guide, if we don't remove the tooth, it's going to try to make the surgical guide around the tooth to fit the tooth. And there's not going to be enough room for the guide tube. There won't be support for the guide tube in that situation. So we need to remove the tooth so that the guide is made properly and the guide tube and the donut, the resin donut surrounding the guide tube are made properly. All right, so now I'm going to jump back into Wizard now that that's done. So that's the tooth removal feature. And we're going to, it saved our changes. It didn't revert. And now we'll go starting to place implants. So I'm going to click on some of our favorites. All right, so we're going to be starting with tooth number 4. Really, the implant, as soon as you put it on the screen, it's going to, the implant will appear. I'm going to just, it highlights also what tooth you're working on. So see how number 4 is visible. So that's sort of a nice feature. It's telling you put the implant right there. Okay, I'm going to click the next implant and just add it in. And then the next implant. Okay, so these are obviously too long. Oh, look at that. Let's bring this one over here. There we go. Okay, so I'm going to make this screen big by pressing the expand icon. So there's our wax up. If we wanted to make this not as opaque, we can click on implant parts, and so we can see through that a little better. So I'm going to center it first there. I'm going to make this a different implant. I'm going to call this a 5-4 and make it a 10. Then I'm going to spin around the implant. This window is a spin around the implant window centered on the axis of the implant. I'm going to move it this way, angle it that way, with those control points. You can change the height of the implant with this circle here and change it depending on what you want to do. Okay, I like that better. You can barely see sort of the bone like through here. I'm going to place it a little bit subcrestal. We'll have to do a bit of sinus augmentation at the same time, especially with the density of the bone there. I'm going to move on to the other ones now. So you can click on this screen to select your implant. This always pops up, which is arguably annoying. You can also double click on, just any implant on this screen. It will center itself. Okay, so here's tooth number 4. Center it from a buccolingual view. We're going to change the size of the length of this implant to a 10. Change the alignment. This is sort of looking from a periapical type of view. Change this alignment. We may find that these implants end up being too close to each other, so we may need to change our implant diameter. I may not be able to use a 4-3 platform switch. I might have to use a 3. Since 5 is going to be immediate, and this tooth is pretty compromised, I'm going to use a long implant in this situation. I'm going to check this view. That's pretty tight. Also check my buccolingual view. Maybe I don't need a 13. Maybe 11.5 is fine. Okay. Click on 4. Let's turn on the Pontic site for 3. Maybe we could do a bridge. Although look at the bone from the sagittal view. This is a pretty poor bone situation. Can maybe do that. Just graft this whole area at time of placement. Or kind of place it somewhere in the middle. The bone does improve there. And we can minimize our view here and look at our 3D model and give us an idea about where that is coming out of. And if we did this, we'd have to have a very thick connector in between our embrasure. Really, we just wouldn't have a lingual embrasure in the bridge design. That could work, and that could be a reasonable compromise in implant placement. Okay, so there we go. That's let's say that we're happy with this implant plan. We've shown virtual extraction. We've shown how to control some of these other boxes. We'll go next. We're going to do our guide sleeve. So because in this case we're using Zimmer Biomet tapered implants, it's identifying the kit that the guided kit that is going to be used with this, and the guided sleeves. You have control over the prolongation. So short tends to be default. You can switch it to long if you need to. Short's always going to be more accurate, but sometimes you need long for space. These two are both 4mm implants, so it's going to do the guide sleeves for these first, and then it's going to move on to the next size of implant, in this case a 5mm implant, so it's going to do that guide sleeve. Approval of planning and agree. It's going to write the planning file, which is a PDF file. Okay, perfect. And then it gives us the option to design the surgical guide. So this would be a good step if I needed to review this plan with a colleague. I could just say I'm done and press next, and it's going to save the case. Or if I know that this is good and I'm going to proceed to surgery right after this, then I'm going to go click design surgical guide and press next. Okay, so here are our guide donuts, or guide tube supports. So this is your radial sleeve offset. This is going to be really custom to your printer. Where are you sending this to? That's probably going to change this offset so that you have the best fit of your metal guide tube. And it doesn't give you a lot of adjustment. You can see it gives you a 0.15 plus or minus, which basically means that in this program you have to use a guide tube. I think there's probably a way to to trick it if you just wanted to use the resin donut itself as the guide tube without a metal insert, but I haven't figured that out yet. It's not as, this doesn't allow you to freely control it as much as other programs. Now, if you have printer presets, once you figure that out, you can select a printer preset. So let's say I'm sending it to a next dent, and then I'll click back on sleeves, and this is my radial sleeve offset, a positive 0.05. So the sleeves were fitting a little bit too tight. We changed it by 0.05, extra, a little bit enlarged, and now the sleeves fit really well. So this could be whether you're sending this to a Form 2, Form 3, Sprint Ray, whatever, you could customize this. And once you adjust that, if I were to adjust this, I could click over here to printer preset, press save, and every time I select that printer, it's going to have this same number here. So I don't have to adjust this each time. All right, so this is the same screen if you're familiar with making occlusal guards or treatment partials. This is basically your bottoms design. It's your undercut blockout. So I like to look at this with the idea that I'm going to be inserting this guide either a little bit maybe from the front or straight onto the occlusion. So you want to make sure that your occlusal plane is not like this when you insert it, right? That's not going to work. It needs to be flat and facing directly out to you. All right, set direction or set insertion direction from view. I never make changes to this. I haven't had to for properly fitting guides, which is awesome. And once you set direction from view, you see how all those arrows change, and then I just press next. The algorithm. So it's going to block out all of the undercuts, but allow just 0.1 undercuts. If you found that your guides were fitting tight, you could change this. Let me go back really fast. I forgot to show one thing. So I didn't talk about this free-forming tab. So this is what the program did. This is the blockout model that it created. This is the model that the surgical guide is going to be made on. And it actually allows you to see that model and see where your undercuts are and see where your blockouts are. Let's say you wanted to add to this a little bit or change. Let's say you wanted to give a little bit more blockout on one tooth. Maybe one tooth had a little orthodontic movement going on, or you knew you were going to change a filling prior to surgery, or something like that. So let's say we didn't want this tooth to be as precisely fitting, or maybe we knew we were going to do a restoration here, like right there, and that was the next step prior to surgery for whatever reason. So if we go to free-forming and we can do add or remove, we could add to this one area and beef that up and bulk that out a little bit. Remove the undercut. Maybe that's a little too, maybe I got a little too zealous there. So we can flatten that. So smooth and flatten, same control points as in ExoCAD. You can click for smoothing, and if you hold shift, it will flatten it, which is a very aggressive smoothing. You can see that there. That's a little bit better. Okay. Good. So let's say that we're happy with that, then we'll press next, and it will save those alterations. So that's the free-forming tab, and it can be useful. All right, so there are our guide donuts. This is our guide borders. I don't like to stop the guide in an embrasure. I think it's much better from a fit standpoint to stop the guide in the middle of a tooth. So we could do one solid guide here, all the way around, or we could do 2 guides. Let's do 2 guides. So let's going to start it through the central. Remember, middle click button to recenter and double click to close that line. Let's do another line. Start clicking here. All right, so let's just review these control points for a second. So really you only need 1 or 2 teeth on either side of your implant for guide stability. But in the posterior, because the posterior is so straight, oftentimes I like to plan more, more extension of your guide past a couple teeth, because as you start to round the arch here, you start to create this U shape. This U shape creates a lot of stability in your guide. Your guide's not going to rock. So if I was placing, let's say, an implant right here, and I just had a little surgical guide from this tooth to this tooth, I'd have a higher chance of that guide rocking. And when I say this tooth, I mean the tooth in front and the tooth behind. If that was, I just made a short little guide, that guide could be unstable. So I like to extend it a bit more. As you start to bend the curve, that guide is going to have really good stability. The nice thing about making 2 guides from a surgical standpoint is the surgeon will also have a bite block usually on one side as they're placing implants on another. So by not having a full arch guide, it allows the surgeon to be a little bit more efficient and not have to take the bite block in and out for whatever reason. All right. So I will press next. Okay, and then here you'll see here the structure. This is an option for placing windows. It's going to automatically turn on your windows. So as soon as you bring your mouse over to your model, you're going to have a window option. This red bit here, this is already a window that's being created. And so you can see you're going to have a little seating window on this tooth. And you're not going to quite have it on this tooth, but we could add one. You have to watch out for these 2 control points here. They can be your friends, but they also can be a pain in the butt if you accidentally click them. So I like to minimize my number of views that I'm looking at. So I really like to look straight to the side, straight buckle. I'm going to change my rotation here. I'm going to drop this down a little bit. I want basically these 2 colors, the red and the purple, to intersect. That means that I'm not going to have a thin, sharp layer of guide like a shard. See that little shard right there? So we're just going to push this over until that shard disappears. All right, perfect. I can change it looking at the occlusal view. So again, 2 views. If it was really off, it was like this or something, that's where these control points can be helpful to make it enlarged and just change the angle. And then I do want strength, so I don't want this too far down because this guide is going to get thin here. So we really just need it high enough to perforate through the tooth and not have any windows of material showing through. See this? See this window of material showing through? That is not a good, that's going to throw a print warning. So let's just unpreview that right there and bring that down until that disappears. That's much better. All right, good. You can't add more things in preview mode, so you have to unclick out of preview mode. Maybe you could add another window right here, so we could do new, add another window, change your control points, look from the top. Not too close to this tooth. You want the plastic to be thick. Good. I'm going to forgo, since this is a tutorial, I'm not going to put any more control points over here just for the sake of time. The next thing is we can do a label. So we can do text debossed. I think that prints better. And so we're going to name this, let's say, the patient's name, or in this case, tutorial. When we bring this over, the tutorial is going to appear, and it's going to appear red where it can't be placed, and it's going to appear purple where it can be. Just click it, and it will set it there, and then you can hold Control and change the angle of the tutorial or angle of the name, and then move it to where you want. I hope that makes sense. Good. And then you can preview that again if you want to. It'll show your, oh, I can't spell. Just kidding. It looks weird. Unpreview and move on. So now we're going to merge our guides. It's going to create our guides. And it has now, has detached parts. Let's see what that looks like. I'm going to click continue. I think what it means is just these are two parts. Sometimes what that means is that there's a space or a perforation from your guide donut to the border of your guide, and we can put in some struts to thicken that up. I really want these to be thick. So for example, this is a really good time to make changes. I don't want this, there's no need for this to be thin in here, so I could go to freeform and add and just bulk this out and then smooth that and use the shift tool to flatten that to make this a nice thick contour. Same thing here. There's no need to have necessarily that could be a potential fracture line if it's really, if there's a really big gash or gap there. We don't want that. Be careful. You can mess up your name by using tools like the smooth and the add tool. So you have to be careful doing that. You also cannot mess up the platform. See how it's not allowing me to add to this guide donut? And that's important because that's making sure that the guide donut's going to always fit the guide tube. So that safety is built in. Let's say that we didn't like this. We wanted this to be strong. We could we could add to here. And try to connect those two parts. Okay, good. So that's going to be a stronger part there. All right, now when we click next, now we have the computer is going to merge these parts. It's going to create a surgical protocol file, or also called a drill report. So we'll have two PDFs now. We'll have sort of a planning PDF and then a surgical drill report or protocol file. And it's also creating the STLs for these two guides, and it's going to save it into your folder, the patient folder that you're working on. And at this point, you're done. You're ready to print the guides. I'm going to make one follow-on tutorial on making a part, because the really nice thing about using ExoPLAN in my mind is if you've done this part, it's really easy to now make teeth and different parts for future aspects of the patient's treatment. All right. And that's it. Thank you.